Welcome to Tooth Talk. I'm here with Dr. Katie Post from the Northwest Dental Group. Thanks again for joining us,
Thank
Dr.
you.
Post.
Thanks for having me. I appreciate it.
You are so welcome. Let's talk about everyone's favorite topic, insurance.
Absolutely. Well, and it's great, right? If your employer, like say you work at Pace and they give you dental insurance, how amazing is that,
Huge.
right?
It's huge.
It's huge. But I think a lot of people don't understand it. Dental insurance is the opposite of medical insurance. Medical insurance, you pay your deductible. Once you pay that, then your insurance covers most of your costs, right? In dental, most people, and like Delta, they may have 200 different packages. So if you say you have Delta and this person over here says they have Delta, your coverage might be completely different between the two of you.
Interesting.
And so you have to know and read, what does my insurance cover? But almost all of the insurances cover between $1,100 and $1,500 total. So say you come in.
Total family or total
Yes.
whomever's involved in that plan. Okay.
Yes, and so let's say that your first visit costs $500, and that's been that way. I've been a dentist 20 years now. It's been that way, the exact same dollar amount from when I started 20 years ago till now.
Interesting.
That hasn't increased at all, which is very interesting to me. And it's interesting, especially when you see how much the CEO of these insurance companies are making.
Yes. Yeah, that's a different topic for a different day.
Yes. However, I don't think people realize typically your cleaning is covered, your exams are covered, your x-rays are covered, but that cost goes in to take away from that $1,500. And so say you get 2 cleanings and an exam and x-ray, well then anything beyond that $1,500, that you have to pay out of pocket for.
Okay.
And so I don't think a lot of people realize that when they're planning things. On the flip side, there's another population, 60% of people have that Delta insurance, don't even go to the dentist. And so we need to get them to take advantage of what their insurance is already paying for.
Especially because if you maintain the health of your teeth, you're not going to have that huge crown or whatever, the root canal, maybe. I mean, you might have to have it anyway, but you know, prevention is.
If you're there every 6 months, there's a much higher likelihood it's a simple, tiny little filling that takes us 5 minutes versus a root canal and a crown, or worse, having to get a dental implant and get that tooth pulled.
Do you have any advice for people that don't have great insurance?
Absolutely. So my parents are farmers. And so a lot of times it's actually more affordable just to go and you can negotiate with your dentist, or to have, like our office has an in-office savings plan that we can set up for you. And so beyond that, most dental offices have payment plans or payment options that they have available.
That's such a wonderful thing. And I don't think people should be embarrassed to go in.
No, no.
You want them to come in and get the dental care, right?
Yes, yeah, and we want to help prevent that.
And what about insurance for kids? If your dental plan often will include the families,
Yes.
but sometimes it does it always?
So
or
now
sometimes
they've
it
changed
doesn't?
that and all the rules, so they do include kids.
Okay.
So I think up until 18, a lot of those kids are really covered.
And what are some of the things that are really expensive?
Yes. So the hard part is a crown, which is really expensive. Most insurances will only cover half of it. So half of that you need to pay out of pocket. Or like a denture, they'll cover half of it. And that's where the policies get a little tricky, because some of the insurances will cover like half of a root canal, some of them won't cover half of a root canal. Some of them will cover a dental implant, some of them won't cover a dental implant. And that's where it's good when you're buying that dental insurance, ask your representative, tell me exactly what these things cover and where they go. I think one of the other thing that's really tricky about insurances is they'll say, hey, you need to go to somebody who's in network. It's very easy to go to somebody out of network, and most of the time there's very little price difference to you as the consumer. What they do is they market to the dentist signs up and becomes in network, and then they send patients to them. And so it might actually even be a better deal if you're going to somebody. So you might want to look at out of network as well and compare the two.
It's important to shop around, right?
It is,
So,
absolutely.
Yes, we just almost out of time, but a question. You mentioned a whole lot of different procedures and how it's covered, and you do all of them at your clinic?
Yeah,
Okay.
we do at Northwest Dental Group. So we're really lucky because we have a great group of doctors. Most of us have done specialties, and so or advanced training is what I should say, in different procedures. So we are able to do the implants, and we're able to do root canals, we're able to see kids. it's a nice way that we can keep a lot of things under one roof.
Wonderful. Dr. Post, thanks again for joining us today.
Yes.
Always a pleasure. And we are going to send it back from Tooth Talk to you guys.